Hi there. We're here today to introduce you to Adam and our social care solution and to tell you a little bit about how we're helping local authorities across the UK. So let's start with the background. £23 billion is spent every year on publicly funded social care across over 1.2 million people. Those numbers are growing year on year, but the number of providers is declining. And so there's an ever growing pressure being placed on councils across the country. We've all seen the headlines. We know that the social care system is in crisis. There's less money, and there's just a constant pressure on local councils to deal with a greater number of people who need more care and support than ever before. And so the common headaches that we come across when talking to our customers are dealing with overstretched budgets, with reduced resources. It's more difficult to get access to good quality, diverse providers. It's hard to focus on service user outcomes. It's hard to focus on actually what's going to help people's well-being rather than just filling need, certainly in particular geographies and certain demographics. And it's difficult to keep people out of long-term care. The focus on prevention and keeping people in their own home is a real focus for social care, but also one of the challenges that needs to be met. And so that's where we come in. Adam connects individuals with appropriate providers. We link different types of care and support, such as care homes, support workers, volunteers, community support, with the people in the community, in the local community, who need access to care and support, or their advocates or their family members. And we do this while giving local authorities complete visibility and control over the full process. So let's break this down into a little bit more detail. The solution is a complete end-to-end transactional tool which covers the full social care process, from engaging with providers through the commissioning and management of care packages right the way through to invoicing and payment. So how does it work in practice? Well, first of all, we build a provider market. We go out and engage with a broad base of compliant providers. We handle all of the document checking, all of the compliance, all of the information capture. And so we can make sure that our customers are always assured that they're buying from a 100% compliant market, and we remove all of the administration, the repetitive admin tasks, and save a significant amount of time and resource for customers in this area. We then allow customers to buy bespoke packages of care tailored to each individual who needs it. We provide instant, easy access to all relevant providers and enable councils to find the most appropriate care package for each individual person. We do this by placing the outcomes of each person and each individual at the centre of this process and asking providers how they're going to best meet someone's needs and improve their well-being. And the unique part of our solution is it can be accessed by all stakeholders involved, by three different parties: by the local authority, by the provider, and by the individual themselves, which means we can monitor and manage and track each care package in real time with far greater accuracy than we ever could before. This allows us to measure the quality of care delivered for every individual, and enables us to react and help our council customers react to changes in need, and to enable them to evolve their service offering to make sure they're actually continuing to meet the needs of their entire community. And then the solution pulls everything together, of course, by handling the invoicing and payment, often a very resource, time-intensive process with a number of our customers. We capture the actual delivery, and so that enables us to automate and streamline the payments process, giving us 100% invoicing accuracy, reducing errors, and eradicating vast numbers of manual and repetitive admin tasks. So our solution truly is an end-to-end process, capturing the full social care journey that a service user would go on. And because we handle that full end-to-end transactional process, we give our customers unprecedented visibility over their social care categories. We enable provider management and service user management being brought together in one place. And we give unprecedented levels of data and insight to allow strategic decisions to be made at a corporate or directorate level. But we aren't just a tech company. We have a highly skilled team of people who make sure that our product works in every single one of our customers. From project managers to our support team to our account managers, we have a range of people who make sure that every single system user be they a broker or a commissioner or a service user themselves, or indeed a provider, are getting the most they can from the system and a high quality experience from start to finish. So in summary, we give access to a fully compliant, better engaged, more responsive market. We deliver outcomes for individuals and improve the quality of care. And we do this by reducing costs for the council and freeing up valuable staff time to enable them to focus on more strategic objectives. And so to give you an example, we've been working with Cardiff City Council for over 5 years now. In that time, we've brought care that's improved by 8% above the market average. We've grown the provider base available and cut the time taken to place people into care by over 3 days. We've done all this by saving the council on average 3 to 4 FTE, which has enabled more strategic working and has enabled us to expand our work with the council to focus on other areas where we can add more value. And I'll leave you with a little bit about us. So we work with over 50 organisations across the UK already, across 93 categories. We have 5,000 registered providers already on our books, and we've helped buy care packages for over 90,000 people across the UK. We manage a spend of over £1 billion and generally work right across the country, as you can see from some of the customers we're already working with. So thank you very much for listening. We'd love to talk to you a bit more about how we can help you. And so if you are interested in learning more, please do get in touch.